Florida.
And I'm Marianne Harmson. Joanne and I have over 50 years of combined experience in the healthcare industry. We have created a new podcast series, Getting to the Core Issues, which is specifically designed to inform you, the public, about the multifaceted pieces of the healthcare puzzle.
Like you, we are concerned about the rising cost of healthcare and its impact on our economy. Our goal is to relay solutions which are evidence-based and meet the needs of the population. In Getting to the Core Issues, we look forward to interviewing experts who will address their areas of expertise and offer solutions to the healthcare puzzle. This segment of Getting to the Core Issues will introduce you to an innovative treatment option for treating orthopedic injuries and arthritis. We're happy to welcome Dr. James Leiber, founder and medical director of New Regeneration Orthopedics of Florida, a former officer, physician, and educator in the U.S. Air Force, and former personal physician to President Bush and Vice President Cheney, and former adjunct professor at the Uniformed Services University of Health Sciences in Bethesda, Maryland, who specializes in non-surgical stem cell and platelet treatments for injuries and arthritis. Dr. Leiber will be discussing the health benefits and cost-effectiveness of stem cell therapies. Welcome, Dr. Leiber.
Thank you for having me.
Glad to have you here. What are the traditional treatment options for orthopedic injuries and arthritis today, and how is stem cell and platelet therapy revolutionizing orthopedic medicine?
Yeah, that's a great question, and that's what we focus on a daily basis. So people who come in with various different orthopedic problems, when we treat and see people who have spine conditions or rotator cuff tears, for example, in the shoulder, knee arthritis, hip arthritis, ligament and tendon issues. These are the kinds of things we treat. And the way that's typically handled and taught to physicians is initially you treat these things with anti-inflammatory medications, maybe some rest, some ice, compression. If that's not working over time, maybe they attend some physical therapy. And then a whole host of other things start to happen is maybe they get cortisone injections, maybe they're placed on narcotic medications, anti-inflammatory medications for long-term instead of the way they're supposed to be used, which is just as a short-term type of medication. And then sometimes that can progress to some type of a surgery, which may or may not be effective for their particular condition. So that's the traditional approach. And what we're doing today, and I'll get a little bit into this as obviously as we're discussing things, what we're doing is eliminating, we believe, about 70% of all of the common elective orthopedic surgeries that occur. And we're helping people stay off of narcotics, stay away from cortisone injections, which have a whole host of problems that we can talk about, and also staying away from chronic anti-inflammatory medications, which people think of as a very benign type of thing because you can get it over the counter, for example, and doctors prescribe it like it's candy. The problem is we know that people have gastrointestinal bleeds from these medications, that they have kidney problems, liver problems, and now we also know long-term use, or not even that long, can cause increased risk of heart attack and strokes. If we can just get people off of these medications and actually away from the standard, the way things are treated, we will be doing them a service because those things actually cause harm in many instances in other ways. The platelets and the stem cells are a way that we can strengthen damaged tissue, decrease inflammation in an area, create stability in a particular area, and with that eliminate or at least decrease substantially the amount of pain and therefore also improve the function. And we're tracking those numbers, and so we know that this is actually happening.
Dr. Leiber, and the types of conditions you mentioned a little bit before, what kind of patients are reasonable candidates for these types of procedures?
For the most part, anybody with a common orthopedic problem, they're at least a candidate for a consultation. What we're seeing a lot of are people who are aging, and that counts people even as young as in 20s and 30s. Everybody's aging, but everybody wants to, at least the people we see, want to remain active. They have a lifestyle that has been active, and they want to remain active, whether that's sports or whether that's playing with their grandkids or whatever it is. They want to be able to move, and those are perfect people. Those are the people we want to help. We want to help people who have pain or having limitations because they can't do the things that they want to do.
Recently, I was at a restaurant and a woman approached me, and I hadn't seen her in about 6 weeks. For the prior year, every time I saw her, she was in such incredible pain, and she was walking with a cane. We're about similar age. And she walked over to the table and said, "Hello, Marianne," bent over and kissed me, and I looked up and I was like, "Lynn, what?
what has happened? She was having back issues, all types of problems with osteoporosis and degeneration of the discs. And she said to me, well, I've had some stem cell therapy. I said, how long ago did you have it? She said, within the last 6 weeks. I go, you look like a different person. And she goes, I feel like a different person. It was the most singular, amazing, quick thing I have ever seen. I know it usually doesn't work quite that fast, I don't think.
No, that's very fast, but we do start to see some clinical improvement somewhere around 6 weeks usually. I'll tell you about the two patients I just saw right before I got on this podcast with you, because I think they're great examples. The last one I just saw 5 minutes before I got on, she was a patient I treated about a year ago, and she's, I believe, in her late 60s, and she was an acrobatic dancer in the circus. And people in this, in that kind of a profession really put a lot of abuse on their body, and especially their hips, which are, they do things with the range of motion that's quite wide, and put a lot of stress on the hips. Anyway, she came to see me, and she had severe, really, really severe hip arthritis. And I was not confident that we were going to get a great result, because that's one of the conditions that we really struggle with in terms of getting good, consistent results with. But it's worth a try, because we do get cases where they really have a good response. And she had a situation in which she also had a lot of swelling inside the bone on top of the arthritis. And so we had to do a very complex procedure that required a lot of highly skilled kind of injection techniques, including going into the bone in her case. And seeing her today was great. She was coming in to see me. I was a little worried maybe she wasn't doing so great. She has a completely different problem. That's why she was seeing me. The hip is doing great. She's 80 to 90% better, and she's able to do all the things she wants to do. And she was struggling with even just standing and walking. So I'd love to see that. That makes me passionate about what I do. I want to keep doing it. The other one was another interesting case, but he was on a completely opposite end of the spectrum. He was about 30 years old, and he was wakeboarding a couple of months ago, and something happened, and he ruptured completely his ACL in his knee, which is a large, thick ligament in the knee, which is commonly torn as part of athletic activities. And there's so many athletes today that have reconstruction, ACL reconstruction. And that does create stability in the knee, but the problem is arthritis can develop in the knee from the trauma, but also from the surgery. And most people we see who've had an ACL injury when they're young have terrible arthritis as they get older. And it doesn't take that long. His MRI showed that his ACL was completely gone. And I felt like there's nothing we can do here. There's nothing we can work with in terms of placing material into anything. So I said, why don't you come into the office and we have some very specialized techniques where we can place the needle where we think the ACL is supposed to be based with live x-ray techniques, and put some contrast material. And if I can get it there and I see some flow of contrast through a structure, I know that there's still some contiguous fibers that are there that we have something to work off of. And we did that and came in, and this was what we call it a diagnostic injection. And in fact, I was able to find some fibers that were still connected from top to bottom, even though the MRI really didn't show it. And that's hopeful, because when we see that, then we have been able to, and we published on this, get these ligaments to regrow and get stronger.
As a physician, that's almost, even for yourself, I'm sure you were just delighted.
Fantastic.
Part of what you're doing is also regulated by the FDA, and there's a difference in terms of stem cell procedures and the way platelets are utilized. Could you tell us a little bit about that?
Yes, I think there's a lot of confusion in the public. There's a lot of confusion even with physicians. People are asking me about this all the time. So there are certain things we can do and certain things that we really shouldn't be doing. There's a lot of people doing things they shouldn't be doing. We can use somebody's platelets from their blood. We can use somebody's bone marrow and isolate stem cells from the bone marrow, as long as we don't violate certain conditions. And the conditions are that the bone marrow can't be more than minimally manipulated. That's the phrase, and there's certain criteria for that. And that it's not used for what's called non-homologous use. Non-homologous means being used for something that it wasn't originally meant to be used for in the body. So we have to use it for something it's meant to be used for, and we can't do any drastic manipulation. And along with that is we have to use it within what's called the same surgical procedure. So if we take it out in the morning and then we use it in that afternoon, that's for the same surgical procedure. We're not violating FDA regulations, and it's actually regulated as body tissue, not as anything like a drug. So that falls within that regulation. And the same thing goes with platelets. What we can't do are a whole bunch of things that are being done commonly. For example, utilizing stem cells from fat tissue. Now, there are, in fact, a lot of stem cells in fat tissue, and there seems to be some value to these stem cells. We believe, aside from everything else, that bone marrow is probably better than fat. There have been head-to-head studies showing that bone marrow stem cells turn into orthopedic tissue better than fat-derived stem cells. However, that aside, there are FDA issues associated with using fat. So when we take fat out, we have to digest that fat, meaning we use an external enzyme to break apart the fat, and that's how we get the stem cells from that. To break apart the fat, you have that external enzyme is violating that minimal manipulation rule. We know that. The FDA has made that clear. It's also being used in what's called a non-homologous way. You're using the fat for arthritis. The FDA does not see that as a use that the body normally uses fat for. Now, there's some argument to that, but that's a different issue. The issue is the FDA has really drawn a line in the sand, has made it clear. They've gone after clinics, they've shut them down, and you really can't be using fat-derived stem cells in the United States. That being said, the other big thing, and I really want to make sure I get this point across, is that a lot of people are advertising amniotic, umbilical, and placental stem cells. And I'm not saying that there's not value to these products. There is value to some of these products. They have a lot of growth factors that are things that are needed to stimulate healing, and they've been used in various different settings for a number of years. Problem is that once these materials are taken at the time of the birth of a C-section of a healthy mother, and they're appropriately tested for infectious diseases and then sterilized and packaged, and by the time they're sold to a doctor, they no longer have any living stem cells in them. And we know that for a couple of reasons. One is because we've taken a lot of these products back to our major laboratory in Denver and tested them, and we're more experienced than anybody in the world in terms of growing stem cells, and we're unable to grow any stem cells out of these products. They don't have any living stem cells, even though they're advertised as such. Furthermore, the FDA requires that they have no stem cells, because if they did have stem cells, they would have to go through 3-phase clinical trials and get approved that way, or now there's another way to get approved through the FDA. Regardless, it has to be approved by the FDA. I should go back to the fat for a second. The FDA considers fat-derived stem cells to be a drug, so they have to go through clinical trials for that. And so that hasn't happened yet. And maybe it will at some point, but it hasn't. So the amniotic, the umbilical, the placental, those are tissue products, not living stem cell products. And we're seeing a lot of chiropractors who are hiring nurse practitioners or PAs and have a DO or MD who's off-site, who's a medical director signing off on things, and a low-skilled PA or nurse practitioner. I have nothing against them. It's just in terms of the techniques needed. The chiropractor can't do injections, and so they're telling patients, hey, we can do these umbilical stem cells for you. It's better than your own bone marrow because they're younger and they can do more things for you. And then they're charging exceedingly high costs for these fees. And so this is terrible. This is fraudulent. This is inappropriate. I even had a patient the other day tell me that the person she went to see told her that what we're doing is fraudulent. So people are getting all of this misinformation, and it's very confusing, and it taints the whole field. I even know of some physicians, MDs, DOs, who are charging. I know one MD not too far from here, very highly trained doctor, is telling patients to use amniotic stem cells and is charging $20,000 to put these into the knee of a 90-year-old man. Point is, not everybody's a candidate. We need to be honest with people about what we can and can't do. We need to be honest with people about what it is we're using, and we need to be charging appropriate costs based on our costs. Mm-hmm. And I don't think that's happening, and it's really tainting the whole field. I want to make sure I get that information out.
Well, Dr. Leiber, I really appreciate your expressing all of those facts, and it's one of the reasons that we were so interested in speaking with you and continuing this conversation, perhaps on an ongoing basis, because clearly, as with any new advancement in medical technology, you're going to have pros and cons, and you're going to have information that perhaps is not accurate. It's critical to advance what you're doing in a way that the public can hear it and understand what the differences are and what to look for, so that they're able to evaluate who is doing the right procedures for what they need, and so that they're not being taken advantage of. And one of the other things that your company is doing, along with the parent company Regenexx, you've got, I think, over 5 million covered lives right now?
We expect about 20 million by next year. And the way we got to that point, which is very important, is data. We have data. So how can I sit in front of a patient and tell them what their chances of likelihood of benefit are from this particular procedure for their condition and their age and all their other health issues. How do I know that information sitting in front of someone? Oh, nobody outside of Regenexx has that information. So one of the things that was so appealing to me about joining Regenexx 6 years ago is, aside from all the skill sets and the laboratory processing techniques that are advanced, has to do with this research and the collection of data. So all the patients who get a Regenexx procedure are tracked across the country by a team of professional clinical researchers. And we have registry data, but we also have clinical trials. But the registry data is very, very powerful. I mean, I know based on your age and your condition, I can tell you your chances of having a benefit from our procedure. And because of that, we've been able to work with self-insured companies, many of which who make their own policy decisions for their employees for coverage. And we've been able to do that for several years now. And then through that relationship, collect cost savings data. And so what we've seen, our data now shows that we're seeing about an 84% cost savings compared to their typical orthopedic spend for their employees. We're seeing good benefit too. For those patients, we're seeing more than 80% are responding in some positive way to the procedure. And then the interesting thing is, if you ask the patient, would you do this procedure again, or would you go for surgery next time? And a lot of these people are surgical candidates. I mean, it's a no-brainer if it works. Their answer is, of course, we would do this again. And we're seeing more than 99% of those employees are saying that they would do the procedure again instead of having orthopedic surgery. So I'm not saying that surgery is not needed. Of course it's needed, and there's certain instances that it's absolutely the best option. And sometimes, even if it is the best option, maybe it's still worth trying one of these procedures. That's a choice that the patient has to make in consultation with the doctor. There are also situations where maybe surgery plus what we can do with Regenexx procedures may be a good option. And those are things that we'll honestly discuss with the patient and come up with a game plan together.
Dr. Leiber, how does Regenexx ensure the safety of the patient? You know, what steps do you take in your lab and in your practice to make sure that patient safety is protected? And what makes you different from other orthopedic doctors who are doing, this type of procedure? So
I think, let me get to that point in two different ways. One is Regenexx, by tracking patients over time, they've also been tracking safety in terms of adverse outcomes and adverse effects from the procedure itself to see, because it was, especially initially, there was a lot of concern that maybe these stem cells can turn into things that you don't want them to turn into, tumors and so forth. The thing is, we're using mesenchymal stem cells from the bone marrow. They're already pre-programmed to turn into orthopedic tissue. They really can't turn into all sorts of different things. So by tracking these patients, Regenexx did publish a study that had several thousand people in it, up to 9 years, showing incredible safety with these procedures in terms of no increased risk greater than what we would see with any other needle injection. So some pain at the time of the procedure is expected. Now, in terms of what we do, would be what's pretty much standard, what a doctor learns to do for appropriate technique, sterile technique in the procedure room. We use ultrasound and fluoroscopic X-ray guidance to make sure the needle gets to where it needs to go properly, doesn't hit something that it's not supposed to hit. So safety, efficacy is very important, to be very highly skilled with these imaging techniques. That is a problem. We're not really seeing a lot of high skill in these areas. And I'm part of an organization, it's a not-for-profit called Interventional Orthopedic Foundation. And the goal is to certify doctors in these different techniques that really have not been part of a traditional training. And so we're doing that. And we're not just training Regenexx doctors. We're trying to train anybody. We're trying to elevate the entire field so that we know that everybody's doing these procedures appropriately. And then in the laboratory setting, we use 1,000-pound sterile hood where all the laboratory material is processed under fully sterile conditions. And in a high level kind of a laboratory techniques. So I think those things, making sure that our techniques are under sterile conditions, using image guidance, the laboratory sterility, and then knowing that our protocols have been tested and standardized so that we're providing safe treatments.
And is the procedure covered by insurance typically?
Well, I think that's what we were getting at earlier. It's being covered by more and more self-insured companies for their employees, but we're not seeing it covered, unfortunately, although I think we know that they can save tons of money. Medicare, Blue Cross, we're not seeing that. But we are seeing coverage through these self-insured companies, and that's who we're going to continue to work with and grow that population.
Well, yeah, and the more you grow that population, the more this statistics will support the insurance companies taking another look at this, because clearly, just judging from the case studies that I saw on your website, some of the self-insured companies, with the actual dollar amounts in terms of their populations and what they've been able to save. It's an enormous amount of money with better outcomes and more sustainable outcomes. Clearly, that is a place that you want to be, and certainly something that we're going to be discussing with you on an ongoing basis, as well as trying to interface with carriers so that they understand. I think an education by yourself to one of the major carriers might be in order, and maybe something we can help facilitate, because you are cutting edge in ways than one, and doing great good. I'm thrilled to hear that you're also training physicians that are not only associated specifically with your company, but with others as well, because the more we do for the greater good, the better it is for everyone.
Is there anything else that you wanted to cover in this podcast that you feel that our listeners should know?
Just be aware that what we're doing is a standardized, evidence-based protocol. It's not, like I said, I'm part of this organization that teaches doctors, so I see lots of doctors from lots of different specialties who, many of which want to learn to do these techniques properly. And it's not easy. It actually takes quite a bit of time. It's a whole different skill set. And those are the doctors that we appreciate working with. But there's a whole host of doctors out there who, I don't know what it is, but I think they think they know what they're doing, but they don't know what they're doing. And those are the ones that are possibly hurting the profession or maybe claims that either they know or don't know are incorrect. We really are in favor of more regulation. We're in favor of more coverage. We're in favor of lowering surgical cases as much as possible because of all the other associated issues with surgery. And we want to keep people away from narcotics and cortisone and anti-inflammatories. I mean, if we could do that, we can save so much money in our healthcare system. And I think we need to think of these innovative ways and be progressive and put the dollars toward the research and really move this country into a modern era.
What would you advise a patient who is maybe looking to have this type of treatment? What questions should they be asking these doctors to kind of vet out who really knows what they're doing and who they should maybe stay away from?
Yeah, that's a great question. And we go over that sometimes in our seminars. One of the things, another red flag that I didn't even mention is that some doctors are taking stem cells from either fat, usually from fat, and sticking it into an IV and then saying that they can cure things like Parkinson's disease and multiple sclerosis and ALS, Lou Gehrig's disease. And this is problematic. Those things may have, stem cells may have some benefit in those areas at some point, but that needs to be done under really strict trial settings. And so I guess one red flag is, if your doctor says they use stem cells to treat everything, run the other way. If the doctor says that they have amniotic stem cells, umbilical stem cells, placental stem cells, run the other way. They either are lying or are misinformed themselves, both of which are a problem. So those are red flags. You want to make sure that the doctor is doing the procedure him or herself, not using a nurse practitioner or a PA to do the procedure, that they should be skilled not only in ultrasound, but for certain techniques, we really need to use fluoroscopy, especially the spine, but there are other techniques as well. So they want to make sure they're skilled in those things. That the doctor's giving you an appropriate evaluation, a full, extensive evaluation, and puts their hands on you and does an actual examination. A lot of doctors skip that part. Hopefully they can do a diagnostic ultrasound, meaning they can use the ultrasound to look at the tissue real time in the office. And we can do that everywhere except the spine for the most part. These are some of the things I think patients should be thinking about when they do a consultation with a doctor.
I looked at some of the videos that you and Dr. Amoroso have on YouTube already. And I think in conjunction with our podcast series and some of the interviews that you've already done, we need to continuously be bumping it to the top of the YouTube exposure list, as they say. So every time you post something new, Joanne, we're going to try to incorporate some of those other videos as well, because the processes that you describe in your office are so professional. When people see that and see the kind of care and see the type of interaction between your physicians with the hands-on, just as you've been describing, it's very, very impressive. So here you are explaining a lot of what is explained in the videos, but in more detail. So this, in conjunction with the videos that are on YouTube, can help people to really get a good grasp on understanding these processes.
Dr. Leiber, thank you for joining us, and we hope to have you back in the future. For more information about Dr. Leiber and Regenexx, visit our website at exigentkey.com. Don't forget to share this podcast with your family and friends, and tune in to our next episode to hear more innovative ideas for solving the healthcare puzzle.